uh, this virus can persist in body in certain areas of the nerves, and later on in life, it gets reactivated and leads to this shingles infection. And shingles or herpes zoster is a extremely painful condition. In fact, it is one of the most painful infections which is known to mankind. And because now we have a vaccine which is gives you almost 80 to 90% chance of not getting it. So it's a very effective vaccine. And even if one gets it after vaccination, the intensity and severity of the disease is much less. And what we call as the pain, which lasts after herpes, is called post-herpetic neuralgia. The incidence of that post-herpetic neuralgia is significantly reduced. So it prevents severe infection, it prevents post-herpetic neuralgia, and in all likelihood, 80 to 90%, it will prevent you from getting herpes zoster or shingles in the first instance itself. The other thing you asked me about the cost, you know, it's a vaccine which is being manufactured by GSK, GlaxoSmithKline, and right now it is only one brand available. So they are in that patent period. Now, when a drug or a molecule is in initial phase of first few years and they have the full monopoly, obviously it is an expensive brand. And once it is out of the patent period, lot of companies, lot of pharmaceutical companies will start producing biosimilars or equivalent of this vaccination, and automatically the prices will come down. So yes, as of now, it is expensive. It is between 8 to 10,000, around that price it is costed one dose, and you have to take 2 doses. So people do ask questions about the need to take it. So what was happening when it was not available? Obviously, many of these vaccines are new vaccines. When they were not available, we were not offering it. But when they are available and they are known to, and there have been long-term studies, by the way, there is a 10-year study on Shingrix vaccine, which has shown that 80 to 85% protection rate remains even after 10 years. And till 10 years, they have also studied the safety profile and found it extremely safe vaccine. So it has all the good points. It prevents a disease, it prevents pain. So why not take it? Cost right now is an important factor, but over a period of time, you can expect the cost to go down. So I think in next few years, we are going to see an increased uptake. And again, second thing is the awareness. We as medical community have to generate this awareness, and sessions like these, I think, contribute towards that awareness generation, where people need to be told that these are diseases which can be prevented. So far, one always thought that, I'm unlucky, I'm unfortunate that I'm getting this disease. But to a large extent, many of these infections are now preventable by these simple vaccines.
But so the age group you think which should take it is above 60?
Yeah, or? Above 60 for sure. In above 50, if they have medical comorbidities. In fact, you need to understand that if a person has medical comorbidities like, cancer, or they are on steroids or drugs which lower immunity, or diabetes which is poorly controlled, kidney disease, asthma, heart disease, in these group of patients, you can give this vaccine at any age. When I said 50 years or 60 years, that is for presumably healthy individuals. But if a person has any disease which increases the risk of these infections, you can use it at any age. But for routine recommendation in India for healthy individuals, we keep it at 60 years because that's what we have got approval for.
Okay. Thank you so much. And I think a lot of people today would be very happy hearing this, because we've been having this talk within ourselves that, a lot of the women would be turning 50 soon. Should they be taking it? Because right now the ad campaign, which is going on with Amitabh Bachchan, it says 50 plus, everybody should go for the vaccine. And
that's what I'm saying. So CDC, the original approver, has approved it for 50 plus healthy individuals. The drug control in India says 60 years. So above 50 years, if anybody wants to take it, we are giving the prescription. No issues on that. Okay. And one needs to remember that people with medical problems, it is a very, very important vaccine. And then there is no age bar for that.
Great. So I think that kind of clears the whole thing. And we know that, when it's required, we need to do it. Do adult vaccines have an effect on women during their puberty? Like, if there are adult vaccines, does that have an effect on women? Because I guess when we say adult vaccine, it would be taken anywhere above 18, or do you all have an age group which is higher than that?
So you are right. So adult vaccines would typically mean people above 18 years of age. Now, in general, let me tell you that these vaccines are a very safe group of products. Now, broadly speaking, there are two categories of vaccines. One is which are made out of either killed virus or subunits of virus. So they are it's a dead virus, or just few particles of dead virus. And then there is another category of vaccines where the virus is living but weakened virus. It has gone through a various process and it's a weakened virus, so that the virus per se in that vaccine does not have the capacity to cause a disease in a healthy individual with good immunity. But the live vaccines are not to be given in certain group of people where the immunity is generally low. They are not to be given in pregnant women. They are not to be given in very young children below 2 years of age. And for people who are on cancer treatments, who are on steroids, or who are diabetic with poorly controlled diabetes, in this group of people, you don't give them the live vaccine. And also above 65 years of age, where the body's immunity is low, you don't give them live vaccines. Other than that, for let's say your question was, does it affect puberty? Answer is clearly no. It does not affect puberty, whether it's a killed vaccine or a live attenuated vaccine. That's a very healthy age group of people, young girls. So it does not interfere. There have been certain questions raised by certain types of vaccines, whether, and this was, in fact, I remember clearly during COVID vaccination, this sort of discussion had cropped up, whether a COVID vaccine can interfere with menstrual periods or the cycles and can cause stopping of the cycles. There have been some reports to that effect, that it has altered the menstrual cycle of certain some women who have taken it. Sometimes for a few months the periods have not happened, but there is no consistency in these reporting, so I cannot either confirm or deny these findings. But other than that, it does not have any long-term effects. Even if these effects are there with certain vaccines, it's a very short-lasting, very temporary effect, and surely it does not either interfere with either the early occurrence of puberty or a delayed occurrence of puberty.
But doctor, so when you say live vaccines, for the most of us, we would not know which are the live vaccines which are available or which one needs to take. So are there any live vaccines which we need to take? Like, when we are saying, we're talking about the shingles vaccine, which you said is not a live vaccine.
Yeah.
So
So the very commonly known live vaccines are the MMR, which is the measles, mumps, and rubella vaccine, which is a very commonly given vaccine in children and also recommended in adults who have not taken in past. And chickenpox. So just like we talked about shingles, there's a chickenpox vaccine, which is also a live vaccine. Then very commonly, this pulse polio abhiyan, which for last 20, 30 years has been going on. They give these polio drops. These polio drops also had live attenuated. Attenuated means a milder form of polio virus. So chickenpox vaccine, MMR vaccine, oral polio vaccine, these are very common examples of some live vaccines which are available. Now, even for some other conditions like typhoid, for example, typhoid, various types of vaccines are there. You have both killed vaccine available and a live vaccine, which is in form of an oral capsule. So there are a lot of examples of live vaccines. The only thing you need to remember is live vaccines are not to be taken in pregnancy, in very young children, and in very old people, and in people with low immunity. Otherwise, these vaccines are also very, very effective and very safe.
And do you recommend these vaccines? Like, I remember all of us have gone through the measles and chickenpox vaccines when we were children. Does that remain for life, or do you, because I mean, even after taking vaccine, I think I can speak for myself at least, I've gone through measles, mumps, chickenpox, everything as a child. I don't think there is nothing out of that we've skipped. So I think
okay. So let me tell you that these vaccines, the ones which you have named, MMR and chickenpox, the live vaccines, they are highly effective in terms that if you have taken them in the way they are prescribed, most of the times they give you a lifelong protection. Now, this is a very common sort of a myth amongst, or misconception amongst people, that even after having taken chickenpox vaccine, I got chickenpox. Now, you need to understand that the chickenpox-like skin rashes can happen with few other types of viral illnesses which have a similar rash. So it may be more likely that the rashes which a person developed were not chickenpox, but some other viral exanthem. Similarly, measles, it may not be measles, but something else. What I'm trying to say is, it is supposed to give you a lifelong immunity. However, in certain adults who are at a high risk of getting these infections, so let's say there is a laboratory person or a doctor who's frequently exposed in laboratory to chickenpox virus. In such group of people, high risk individuals, we advise even in adult age for them to take a booster of MMR and of chickenpox, even if they have had taken full vaccination in their childhood. So in certain high risk areas, we recommend boosters of these children's vaccinations even in adult age. But for all other non-high risk groups, childhood vaccination of chickenpox and MMR is good enough to give you a lifelong immunity.
Thank you, doctor. That is really helpful. Now, doctor, it's a common myth that they say that vaccines in reality reduces a person's immunity. Do you think so? I mean, they were saying even for COVID, I know a lot of people did not take the vaccination because of this. Of course, a lot of people also had the apprehension that it was not tested enough to be taken. But then there were also people who felt that taking the COVID vaccine could reduce the immunity to fighting COVID. Or so I guess similarly for other things as well. So
very interesting. So you are asking whether it reduces immunity. There are people who have asked me that does it change your genes, and will COVID vaccine make a human being a monkey? So
I am not that bad.
So no, answer is clearly no. We need to understand, to answer this question, what vaccine does. Okay. Now, vaccine in vaccination, what we do is we inject, let's say it's a virus against which you have to give a vaccine. So it's either a live mild virus or a dead virus, or just few particles of the dead virus, which are injected. And normally it is combined with what we call as an adjuvant. Adjuvant is a carrier base or a carrier molecule on which this sits. What this carrier molecule, it is generally aluminum based and all. They also increased the effectiveness of these vaccines and make it more stable in the body. Now, when we inject these particles or the viruses or the virus particles in the body's immune cells immediately recognize this as being a foreign substance in the body, something which is not body's own. So the body's defense mechanism, immunity, immediately triggers and creates protective antibodies. And these protective antibodies are directed against these particles, cells, or viruses, and they kill them. Okay. Now that one episode is over. So you've given one dose of vaccine, immediately body reacted by forming antibodies. And then these antibodies over a period of time settle down, become low in terms of amount. Later on in life, or at any stage in life, if one then encounters a real virus, and that real virus then enters the body through, let's say, nose or mouth or whichever area, body immediately recognizes, body's immunity has what is called as memory cells. These memory cells immediately tell, look, 10 years back, your body was exposed to a similar particles that was in form of vaccine. So within few hours, body's immune system generates so much of antibodies against that virus which has entered your body that it immediately kills that virus, and the body's immunity wins over that battle. Had you not had taken that vaccination, remember that your body will still develop these antibodies when you are encountering a virus, but it takes a much longer time frame. So it may take few days. And by that time, this virus or this bacteria may become so overwhelming that it actually kills a person. So it reduces the time from days to few hours, and immediately it destroys. So the memory cells remain in body forever. And so saying that vaccinations will reduce your immunity, it's actually other way around. They keep stimulating your immunity and keep your immune system active and on full guard. So there is no reason to say that your defenses get weak by taking more vaccinations. That's one.
So then, Doc, that gets us to a question that what are the important vaccines that anybody should take, say, above the age of 40, whether men or women? And, are there different vaccines for men and women that they should be taking above 40, or is it the same?
No, so okay, so let me first tell you the important vaccines which adults need to take. And in this, let's keep the definition of adults as above 18 years. So influenza vaccine, this is the common flu vaccine. Pneumococcal vaccine, which is also known as pneumonia vaccine. Then the chickenpox vaccine, we have shortly talked about that. We have talked about in detail the shingles vaccine that is now being recommended as the must-take vaccine. Then the MMR vaccine and the DPT vaccine. MMR, we also discussed about the measles, mumps, and rubella. And the DPT is again a very popular, universally given childhood vaccine, diphtheria, pertussis, and tetanus. We can probably talk about this particular vaccine in more detail subsequently, but it is also considered as a vaccination for adults because it is required to be given as boosters after your basic childhood immunization has been completed. And last but not the least, the human papilloma virus, which is the prevention for cervical cancer. So these, if you ask me, are the list of must-do vaccination for adults. Now, there are many other vaccines which are available for adults, which are optional or will be recommended by your treating doctor on an individual case-to-case basis, depending upon your underlying medical problems, your occupation, and your risk of acquiring such infections. And to name these things like hepatitis A and hepatitis B, which is the jaundice-causing viruses, then meningococcal vaccine, okay, then typhoid vaccine, cholera vaccine, you have respiratory syncytial virus vaccine, you have rotavirus vaccine. Now, rotavirus vaccine, for example, is now become a mandatory vaccine for children. In adults, this is a much less commonly seen condition, but sometimes there are local outbreaks where we can then give these rotavirus vaccines. Rabies vaccine, again, rabies vaccine has specific indications. And again, another one is the Haemophilus influenza B vaccine. So many of these vaccines become the mandatory list in children, but become optional in adults. So these are all long list of vaccines which your doctor can then decide for an individual patient whether he or she needs it or not. But the first ones which I described are now being recommended by various scientific bodies. And here I am actually quoting for India, the best guidelines for adult vaccination have been created by the Associations of Physicians of India. It's called API, and these are called the API guidelines, which came out a few years back. So that's the basis on which we are giving these recommendations.
So, Doc, if I was to say that, which are the, say, 2 or 3 vaccinations which you would absolutely recommend for all adults, and we were keeping the adult thing at 18, that you would say that these vaccines, no matter what, everybody, all adults should take, whether, I mean, of course, if there is something that your doctor says, could hamper, like you said, there are certain vaccines, but otherwise that everybody should take it. What would those be, and how frequently would those be needed to be taken also? It's something that I guess we need to know.
Okay. So I think here, the top of the list, I would talk about influenza vaccine or the normal common flu vaccine. And one would really argue at this stage, why I give a vaccine against flu? It's such a common condition. It's such a mild disease, lasts for a few days and then goes away. Why should we take vaccination? And the answer is very straightforward. The mortality or the deaths or the morbidity, that's the disease burden, which is caused by common flu, is grossly underreported. Okay. Now, if you open the statistics and Google it, it would say that 3 to 5 million cases annually happen because of influenza, out of which 2 to 5 lakh people die every year because of flu and flu-related illnesses. And this, I can tell you, is a tip of the reporting. It is grossly underreported. Okay. In India, especially now, these figures are not available because this is really not, frankly, a reportable disease. So people even don't report it. And many times people will not go to a doctor for flu. So, and especially in elderlies, especially with people with multiple medical problems, diabetes, etc. And we know that we have the largest number of diabetics and hypertensives, high BP people in the world, anywhere in the world. So in such people, It may be flu virus, which actually triggers a heart failure. Flu virus, which can trigger a heart attack. Flu virus, which can trigger a stroke. Why do heart attacks become more in winters? One of the reasons for that is flu or influenza. So influenza causes problems, health problems directly, which are mild, but bigger problem happens indirectly. And again, by a simple vaccination, it is all preventable. It is a highly effective vaccine. It will either prevent you from getting flu, or if one gets a flu, it will be a very mild type of flu. The important to note is when to give it, timing. As I said, it is an annual vaccine. Why annual vaccine? Because the immunity fades off. So like we discussed, some vaccines cause, you give one vaccine and it gives you lifelong protection. Influenza vaccine gives you protection only up to a year. After that, the protection rate wears off. Secondly, the vaccine is given every year, a new vaccine is made depending upon which are the viruses which are prevalent in that region or geography in that particular year. So we have something called a Northern Hemisphere vaccine and a Southern Hemisphere vaccine. And every vaccine for influenza would have a year on it. So it will say Northern Hemisphere vaccine 2023. That's the vaccine you have to take. It is presently the vaccine which we use is effective against 4 types of influenza viruses, 2 of type A and 2 of type B. And the 2 of type A includes that H1N1, which is the so-called the swine flu. So it gives you protection against swine flu also, and H3N2. So these are the 2 very common seasonal flu viruses. Now, in Delhi or in northern part of the country, we have 2 peaks of influenza or flu seasons, we call it. Presently is one. So post-monsoon is a very important peak in Delhi. And the other is winters. So January, February, and March. So the best time to take vaccine in a place like Delhi is September or October, or maybe even earlier. Let's say beginning September, so that you can protect yourself against this post-monsoon peak also. It takes 2 weeks to give you protection. Okay. And always insist on taking the vaccine which is latest for that year. And normally in Delhi or in North India, the latest vaccine comes around this time of the year only, August, September. So the moment it comes, that's the best time to take it. And remember to take it every year. And who should take it? World over, it is recommended that every person above 6 months of age should take it. And there is no upper limit to it. In terms of adults, we say every adult patient who has some medical problem must take it. It is a mandatory vaccine. It should also ideally be taken by every healthy adult who does not have any other medical problems, because taking the vaccine yourself, you are protecting other vulnerable people. Because if I don't take the vaccine, saying that I am absolutely healthy, I have no medical problems, I will get flu and will take it home and give it to my parents who are the vulnerable population. So in order to prevent the transmission of virus to vulnerable people, I myself have the obligation to take the vaccine. That is the way I can protect my parents. So similarly in office. So to prevent people around you also, your vaccination has a role too. The second vaccine is pneumonia vaccine, pneumococcal vaccine. Now, pneumococcal vaccine is not an annual vaccine. So you take a series of a course of total 3 vaccines over, let's say, 5 to 10 years. So you take one vaccine now, you take another vaccine after 6 to 12 months, and a final booster after 5 years. And that's, you're done with it. It gives you a very good protection against the common bacteria which cause pneumonias. And pneumonias, we know that in a place like Delhi, where there's a lot of air pollution, a lot of dust, and there's a lot of infection burden, there's a lot of cases of pneumonia we see even in healthy adults. So it gives you protection, a reasonably good protection against this. The others, we spoke about the shingles vaccine, similarly chickenpox vaccine. Now, remember that in childhood, although chickenpox vaccine is a childhood vaccine, but why am I saying it for adults? Because if chickenpox kills 1 child out of lakh, it will kill 15 adults out of lakh.
Wow.
So chickenpox is 15 times more fatal in adults than in children. So for adults, actually chickenpox And the rashes, it lasts much longer. It's a much more debilitating illness for adults. So that's the reason why we recommend a chickenpox vaccine to be taken in adults, especially if you have not taken in childhood. And many of us would not even know or remember whether we have taken it. And at the time I'm talking about, this vaccine was not even available. So many of adults of our age group, middle age group, are non-vaccinated against chickenpox. So it is good to take it. Okay, and it is just one or sometimes two shots which are required and gives you a long-term immunity. Similarly, we talked about DPT and MMR, and it is important to bring it up at this stage. Again, these are two common childhood vaccinations. Every parent would remember having given this to their children in present age. But why we talk about in adults is because there has been resurgence of infections like measles and rubella in pockets in adult population, because either they have not taken MMR as child or their immunity has faded out. So one booster shot of MMR gives you again a lifelong protection in adult age. And as far as the DPT is concerned, all of us remember, when we have an injury, we go ahead and ask a doctor to give us a TT injection, tetanus toxoid injection. Then there's another discussion about role of tetanus toxoid injection in pregnancy. Every pregnant woman was recommended to be given a tetanus toxoid injection. Well, now universally and in India also, what we are saying is replace that tetanus injection by a TD injection. TD injection gives you tetanus and diphtheria protection, because diphtheria has become, interestingly, another re-emerging disease of adults. It was only seen in children. Then because of universal DPT vaccination in childhood, diphtheria vanished in children, but it resurfaced in adults. So now we say that even for adults, one dose of Tdap is the tetanus, diphtheria, and pertussis milder form. Take that injection, and then every 10 years, you take a booster of TD, tetanus, diphtheria. Then you don't, if you have an injury or if you have any such thing, you don't have to rush in for a TT injection every time. And in pregnancy, it is very important that our national program has clearly said that the TD vaccine has to be given to pregnant women every time she becomes pregnant. And the earlier you give it, the better. Earlier they used to say was give it in second or third trimester. Now they say, the national guidelines say, give the TD vaccine in the first trimester itself, every time one becomes pregnant. And the last vaccine, which I said amongst the list of mandatory vaccines, was the preventive vaccine for cancer, the human papilloma virus. A very interesting vaccine. Who has to take it? So ideally speaking, it is to be given to both boys and girls. You may ask me, it is a prevention for cervical cancer, so why give it to boys? What happens is this particular virus called human papilloma virus, HPV, comes into our body after the first sexual encounter. Before that, we don't have this virus. But after the first sexual encounter, practically everybody gets this virus. And if person has different partners, you can get different types of human papilloma virus in the body. There are many types of human papilloma virus, out of which two types, type 16 and 18, are known to cause cancers. Most commonly, the women cancers, that's a cervical cancer, cancer of vagina, and cancer of vulva. Plus, it can also cause anal cancer, and it can cause oral or oropharyngeal cancers, and it can cause genital warts. And for the last three conditions, to prevent that, we say even boys are to be given, because anal cancers and oral cancers can happen to boys also. So this one vaccine is a vaccine which can prevent so many cancers. Now in India, at one time, cervical cancer was considered the commonest female cancer. No longer it is, now it's a breast cancer. And remember, by this vaccine, it is preventable. You can prevent a person from getting a cancer. Who is to take? The best age to give this vaccine is between 9 to 26 years of age. But the age group is extended from 26 to 45 also. So people, men and women between 26 to 45 years can also go ahead and take the human papilloma virus vaccine. Now, if you take it before 15 years of age, then you have to take only 2 doses at 0 month and 6 months interval. Whereas if you take start the vaccine after 15 years of age, then you have to take 3 doses, 0, 1, and 6 months interval. Okay. And in India, many preparations. So there are different types of cervical cancer vaccines across the world. Some have against 2 strains, some have against 4 strains, some have against 9 strains. All of these are available in our country also. So the one commonly we use is the 4 strain, which is called the Gardasil. And recently, Serum Institute of India last year, Modi ji was also involved in sort of release of that vaccine, the indigenous cheaper form of cervical cancer vaccines. That's the one which is now being propagated by the government institutes and public hospitals. So what I'm trying to say is all these vaccines are effective because all these vaccines cover against the strain 16 and 18 and are highly recommended to be given. This is a very important query asked to us by the parents. Our young daughter, young boy, should we not? Are there any tests to be done? Our child is still not sexually active, not married. Do you think we should still take it? What is the right time to take it? Do we need any tests to be done? So do we need to do a pap smear? Answer is no, you don't need to do any pap smear. Do we need to check that whether my child already has a human papilloma virus infection or not? You don't have to check it. In pregnancy, we don't recommend it to be taken. So if a woman is pregnant, then we tell them to delay the vaccination and take it only after pregnancy. But do we need to test for pregnancy before giving the vaccination? No, you don't need to check for pregnancy. So these are very important queries which the parents ask us. I think this is one of those vaccines which has a huge impact in terms of reducing the cancer burden, especially women cancer burden, and must be advocated. So this is, I've given a long answer to a short question because I thought that this is a very relevant, pertinent.
Doc, and I think what you've told us is, this is something which is very relevant today, and the kind of, you can see the kind of diseases which are coming up. Until COVID, none of us ever thought something like COVID could hit us. So one really doesn't know what one is entering into. And if there are things where we can help and we can prevent, then why not kind of go ahead and do it? And this is something, an eye-opener, doctor. So that is something, and I will come back to the cervix cancer question, because we do have a few questions on that as well. Doctor, what about the side effects of vaccination? This is again something that I'm coming up because you keep hearing, especially about, again, the cervix cancer vaccination. There is a lot of apprehension around it even now, and even around other, vaccinations. There, people say, oh, there are side effects. Yes, you do hear about maybe sometimes that you can get temperature or something. That could be a different thing. But apart from that, what would you say about side effects of these vaccinations? Are there any which one knows of or not, or what is it?
So I think let's divide this answer into question into two types of answers. One is some very generic side effects which will be common to most of the vaccines. Okay, so these are local side effects. So pain, some redness, some swelling, tenderness at the site where the injection has been given. Most of these injections will have some minor side effects. Low-grade fever, so you may have fever for a day or two, take simple paracetamol and that gets okay. Fatigue, myalgias, again, myalgias means body aches. Again, very common side effects, self-limiting, 1 or 2 days. So these are common side effects most of the vaccines will cause. Specific allergic reactions. Now, if a person has history of very strong allergies, or if a person has history of allergies previously to the same injection, then you avoid giving that injection because it can lead to sometimes serious allergic reactions which may be difficult to control, and very rarely, they can be fatal also. Now, there is a correlation between people who have egg allergies and them taking flu vaccine. So it is, I think, too overrated than real being true, because what people presume as allergy to egg is maybe a very mild allergy. So mild form of egg allergies does not form a contraindication to taking flu vaccine. But if a person gives a very clear-cut history that he has had a nearly fatal allergic reaction to egg, then obviously in such cases, you will not give them flu vaccines. Now, I think this issue of side effects of vaccines really became a very important public discussion during this COVID time, when the COVID vaccines came up and people started talking about how these vaccines, and especially the Pfizer and the Moderna mRNA vaccine, that's where actually, interestingly, I put that joke where people started saying that here you are injecting an RNA into a person, so you're changing a human being into a monkey. So does it impact or change your genes? Answer is no, it can't change your genes. But yes, there have been some reported adverse effects of vaccines, especially COVID. And why we are talking about COVID? Because that was one example of an adult vaccination, which practically everybody in the globe. So we have what, 7 billion population on the earth? I think 80% of this population would have taken COVID vaccine over a very short time frame. So definitely when such a large population on your planet takes vaccines, the number of people who report side effects will be much larger than if a vaccine is spread over 30 years. And that also only 2% of the world's population takes it. So I would say the side effects of COVID vaccines are again overrated than what they actually are. And like what are the 3-4 very commonly known or in media reported side effects or Googling side effects of COVID vaccine? One they talk about is these clots formation in young people, especially with a vaccine like Covishield. Now, let me tell you, in women who take oral contraceptive pills, the risk of this thrombosis in the brain, we call it as cortical vein thrombosis, is 12 times more than what the vaccine can cause. Second thing, to increase incidence of heart attacks and sudden cardiac death in young people. There have been reported cases, but again, if you see that disease as a separate entity, that disease existed. But yes, in a small percentage of cases, certain types of these COVID vaccines did increase the risk of blood clotting, but that number was way smaller than the protection so the lives it saved. It would have saved one life, or not even, it would have saved 1 lakh lives and caused one death. Let's put it that. Now, myocarditis, that is the heart muscle failing, has been reported as a side effect in some cases of the mRNA vaccines, the Pfizer and the Moderna vaccine. Again, they say that myocarditis can happen even because of COVID as a disease. And myocarditis happening as out of COVID is 6 times more frequently seen than the myocarditis which is caused by the vaccine. So you are actually reducing the chances of a person getting myocarditis by 1/6 by taking the vaccination. So again, you have to understand that any drug, any medicine, and vaccine is a drug, does have side effects, but they have to be weighed and balanced against the potential benefits they give you at a larger population level. So the doctor's responsibility is to understand and assess the risk of an individual for getting this adverse effect. So if a person has strong history of allergy, I will not recommend vaccines to that patient. But a healthy adult, yes, I would recommend, because I know that it is very likely that he or she would get COVID in his lifetime or would have got, and preventing that will give me benefit, more benefit than the potential side effects. So now, especially about this Gardasil vaccine, the cervical cancer vaccine, whether it leads to infertility in women, whether it leads to delayed puberty or etc. I think no. The debate has clearly shown there are a huge number of papers to prove its safety. And I don't think any of that discussion really holds a scientific basis to it at the moment.
So doctor, like we're just discussing the whole side effect thing and affecting, so there is this whole anti-vax community abroad, and what strikes you most about that? They have documented cases of children on wheelchairs and, or their brain health issues or general health issues because of vaccination. And you see that the governments really don't let them, their voices to come out. They are usually suppressed. What would you think about that? I mean, that is a trauma a parent goes through if you go to see. So for them, if we kind of give them the thing that, oh, it's 1 in a million, or, I don't think for a parent whose child gets that reaction really wants to know that. But what do you think about it? Is it there are like a good number of people or children especially who get affected by these vaccinations, or again, is it a very small number and there is like you say, there is a good and a bad to everything? So what would you say about that, doctor?
So first thing I would like to say is we should be very clear about one thing, that this vaccination is a recommendation. It is an option given to the family. It is not a mandate that, you will not be allowed to stay in the country unless until you take this. It's not like that. Okay. So it is clearly given after talking to the family. It is a list of recommended vaccines, but again, optional, and again, only after consenting parents And in case of adults, the adult consenting to it. And there was a huge ethical debate uh, during the COVID times after this vaccination came up, and the international travel was linked to taking the vaccines. So that means people who do not want to opt for vaccines could not then do the air travel. So that became a very big ethical issue, because at one end we are saying it is optional, but at second end we are saying no, it is optional only to an extent that in case you want to travel, then it becomes a mandatory requirement. So I can't go to US or Europe if I have not completed my booster dose, let alone the primary doses. So that became a hugely controversial issue and discussion, and I don't think there was any sort of answer to that. And now, of course, the words open up, and even if people are not vaccinated, nobody's asking for it. But vaccination, and this I had also talked in the initial part of my discussion, has serves two purposes. One is protecting your health, and second is protecting the health of people and community and nation and world at the large. Because like what happened in COVID, we say that the affluent countries were hoarding vaccines, had easy access to vaccines, and the not so affluent people, let's say this, the sub-Saharan African continent, was largely missing on the COVID vaccines. It was being said repeatedly that if we leave pockets of unvaccinated people in the world or in a community, the risk increases for you also.
Correct.
And you will, even if you are vaccinated, you will still get resistant, you will get reinfection by viruses which are mutated, because there are pockets of countries which are left which are unvaccinated. So this is an example to show that more the number of people who take vaccine, the less the chance that that infection will ever spread in the community or in the country or in the world. Pulse polio abhiyan. Why was it? Because it was not for me or XYZ as an individual. It was that more people take it, more drops you take it, the less will be the, and ultimately India eradicated polio. But there was a talk of vaccine-induced polio paralysis. So that is the reason why the oral polio vaccine was changed in our program to injectable polio vaccine. So answer is yes, there will be some unfortunate people, children, adults, who will get side effects, and sometimes very critical, life-threatening, debilitating side effects. But that number is so low. And that is true about even simple crocin. If you take in and read the instructions, crocin tablet also says a person can die of liver failure because of taking crocin. But when you have fever, you don't shy away from taking crocin. So it's like that. So we have to accept, because we are seeing at a much larger level, in fact, at a global level, and to reduce the burden of, and India, by the way, is a country where we have a dual burden. The infectious disease burden has not gone down, in fact, going up only, and non-communicable disease, diabetes, heart attacks, cancers, we are again the world leaders in that. So for a country like ours, we actually cannot risk having this debate of shying away from taking preventive measures. And there was a very interesting study during end of COVID times, a global study where they compared the behavior of people opting for vaccines or anti-vaxxers, as you say. And by the way, India fared amongst one of the best accepting countries in terms of COVID vaccination, and the number of anti-vaxxers were much higher in Europe and US than in India. So that was a very sort of enlightening study, that even if our people are not so literate at a rural level or overall at a population level, but still the penetration and the awareness generated at a local level was so good that people really opted for it. So it's how you tell people, right? Messaging is most important.
No, but that is what my next question is, doctor, that are you like a pro to extensive vaccination, or are you conservative? Because
no, I'm absolutely pro.
Yeah, so the thing is, that is what they say, that in India, like you yourself said, that when the whole thing came out, we were one of the countries where people had taken maximum vaccinations. So that's an interesting thing, because that is where the whole debate is, that do our Indian doctors, are they the ones who really propagate vaccination? And because like you rightly said yourself, that when you talk to people in America or Europe, a lot of them have not been vaccinated for a lot of things that we are, like, of course, like TB, it is, of course, now in India also.
Yeah.
We've all had those vaccinations, and there are times when you get that test done and there'll be something which comes as positive in, you don't have TB, that you're not suffering from TB, but there is something which shows positive in it.
Yeah.
I,
So
I know.
that is, if you're talking about this TB thing, I'll just clarify that. That's a Montus test or the quantiferon test you're talking about. Most Indians would show that positive because
Why?
all of us staying in India for so many years have had an exposure to TB bacteria.
Oh,
And we have been, our body has encountered TB bacteria, but our immunity was good enough to fight it and ward it off. So that means our bodies have antibodies against the TB bacteria. So if you do this test, it will show positive. So the positive test has no relevance in Indian context. And by the way, BCG vaccine, which is a prevention against TB, is given as a part of universal immunization program to children at birth. So that's a day zero vaccine. So because of this high uptake of BCG, also this MON2 test may show positive. So
yeah, that's
that's
what
a,
I'm saying.
yeah,
That is
yeah.
in America,
And
they don't give children
they
this.
don't give. So the vaccination against infections has to be a regional policy. Every country has its immunization policy. Indian immunization policy is very different from what is recommended in US or in Africa. In Africa, everybody gets a yellow fever vaccine. Interestingly, this is again a very interesting, one doesn't have an answer. The same mosquito which causes dengue also causes yellow fever. Yellow fever is rampant in Africa as a continent, but there has never been a reported single case of yellow fever in India, even when we have the vector, the mosquito which spreads it so rampant. One doesn't know the answer. And that's the reason anybody who travels to Africa has to take a yellow fever vaccine. You will not be allowed to travel to Africa unless until you have that yellow card. Had that policy not been there of mandating, that means you will not be allowed to travel. So that level of strictness has prevented a major disease from coming into India so far. So vaccination policies are always regional. And when doctors recommend the vaccinations, we go by clear evidence and the policies which are laid for that region or country. Now, I would not be advising an exotic vaccine just because it's a newly introduced vaccine where I don't know the benefit, don't know the potential side effects, and it is not recommended by the regulator. So it has to have a prior recommendation by the regulator for us as doctors to prescribe it. Now, doctors becoming anti-vaxxers is a very risky proposition. That's not the realm of doctors to be in. Our role is to recommend and advise, give pros and cons. If the family, parents, mother asks us about the potential side effects, we always tell them. Final decision, the parents or the people who are to take it. But as doctors, we must give a complete picture and not say negative things just because we personally believe or not believe in those things. That's my thought.
Doctor, another thing, of course, which everybody says that in India, there's been Ayurveda and there's been alternate medicine, and we've always had it. And, I'm sure that there were influenza and different kind of strains even earlier, but nobody ever took vaccines, and it's just a cold and flu and it gets over. Then why should one go in for a vaccine at all when it comes to, today we talk about viral fever, and we've seen even right now, I know of so many people who are suffering and it's been bad. You've heard of really bad viral fevers, but even then people say it's only viral, 5 days, it'll go. Why should we take a vaccine unnecessarily, put something in your body that you don't know? Would you
Okay,
still?
so I would like to answer that question in two ways. First
Yeah.
way is the average lifespan of human beings 200 years back and now, at least 3 decades more, average lifespan of a single individual. All that is thanks, and this is in spite of more polluted air, more polluted water, less quality of food, more stress. Still, the average lifespan of a human being has gone up from 50s to 80s, or at least in India's late 70s. I think it's things like these. Vaccinations have a huge role. Safety, cleanliness, environmental safety, all that, hygiene, safety, good antibiotics, good medical treatments, early diagnosis of treatment conditions, all that has a role to play. Now, the other example I can give you, corollary, saying that 30 years back, we never used mobile phones. Why do you need to use mobile phones? Now, India has a population of 1.3 billion, and I think over 1 million smart handsets are sold in India. Everybody uses it. And for technology, we say be ahead of technology, adopt what is latest because technology is good for you. So this is also technological advancement. Vaccines are nothing but wonders of technology. Earlier, one vaccine development used to take 2 decades. In COVID time, we came up with COVID vaccines in 10 months. This is nothing but technology. You adopt technology for healthcare, for well-being of human beings. It's the same as adopting iPhones or smartphones for yourself.
So, doctor, that brings me to my next question that, for COVID, we could manage a vaccine in 10 months, but apart from cervix cancer, we haven't been able to come out with a vaccine for cancer in general. There are so many cancers. I think every part of your body can have cancer. And we haven't been able to do anything which can prevent. And nowadays you hear of it even being more rampant than anything else. It could be like a lot of people say it's a diagnostics now that you get to know. And in the olden days, there was no diagnostics, so one did not get to know. But what would you say? Why haven't we been able to get a vaccine for cancer till now?
Okay. So first of all, let me tell you the two vaccines, the cervical cancer vaccine, which prevents against not only cervical cancer, but which I have named 5 cancers against which it gives protection. And second is the hepatitis B vaccine, which also prevents, because hepatitis B can lead to liver cancer. So these are the two very good examples of vaccines which prevent cancers from happening. Now, your question is, why have we not been able to develop vaccines against cancer as a treatment? Okay, we have been able to develop. There has been some breakthrough in the recent years. And why cancer is different? Because when virus and bacteria enters our body immediately recognizes that as a foreign molecule in the body, and our immune system fights it, whether or not you have a vaccination. Cancer, by the way, originates from within the body. And the mere fact that cancer grows into a big tumor is because it is your body's own cells which are growing within the body. And hence, if it starts growing uncontrolled, the body's immune system does not recognize these cells as foreign. It says, these are my body cells, so why should I fight against it? So it lets the cancer become a tumor. And that's precisely the reason why vaccines are difficult to be made technologically in treating cancers. But now we have vaccines under the heading called immunotherapy, which are actually not preventive vaccines, but what we call as therapeutic vaccines. And in fact, most of the development which is happening world over in the area of vaccination now is in the area of therapeutic vaccinations. That means vaccinations which will not only prevent, but treat cancers. And the best part of these vaccinations are that they are sometimes even personalized vaccinations. So this vaccine will be made for a person with that cancer and only effective for that particular person. Because we take out the cancer cells from that patient, identify the cells on that cell, proteins on that cell, make a vaccine against that protein and inject it back. So it will kill his cancer, but not another person's cancer. So that's one type of personalized immunotherapy, which is vaccine. Similarly, you can have against, let's say, pancreatic cancer. World is almost nearing a successful vaccine. So anybody with pancreatic cancer, you can give that injection. But because these tumors have a lot of cells, alone this vaccination will not help. So you have to combine it with surgery and chemotherapy and radiation therapy. What these vaccines do in treating cancer is they go and put another protein on these cancer cells. So the moment you do that, the body immediately recognizes this is not my own cell, and it develops a antibody immunity against it and fights the cells. So the self-recognizing cells become non-self-recognizing cells. So huge interesting development. At least there are 18 to 20 cancers against which the world over basic research is happening in immunotherapy. And I think in the next 3 to 5 years, they are saying the treatment of cancers is going to completely change. And you can actually, we are now at a stage where we can identify the genetic defect which has led to that cancer or neurological disease, remove that portion of gene and correct the disease. And in fact, they are saying that in 10 years time, the science may reach a level where human beings will start deciding how long they want to live.
Wow. I don't think I want to be there, but yes, that would be another discussion. But doctor, you said that if you haven't taken the vaccine till you're 45, should women or men still take it after 45 or not?
No. So it is not recommended beyond 45. So the reason it is best time is 9 to 26 years.
Okay.
And why I'm saying that is because it is recommended the vaccine should be taken before you indulge in first sexual intercourse.
Yes, of course.
That's the reason why the time frame 9 to 26 has been given and extended to 45 years. Now, beyond 45 years, with age, anyway, the chances of you getting a new human papilloma virus infection goes down dramatically.
Okay, so that is something which is good to know. Doctor, and one question which I'm sure everybody must be really wanting to know, what do you think about COVID? Because as you hear as of now, the West is already again hitting big numbers of COVID, and the talk is that India is going to hit big numbers of COVID in October. Is it again going to be a bad one? Are we ever going to get rid of it? Is it going to become like a viral, ki acha ho gaya, koi baat nahi? Or what will be the status on that?
I think the last statement which you made is more near the truth, that there is no way that this virus is suddenly going to disappear from the world. It's not going to happen. It's a very smart virus. It keeps mutating. The good part is that in the first 2 years, the major mutations happened every 6 months. So we had alpha, then beta, then delta, and then omicron. But from the time 2020 end, when Omicron came, Omicron has remained the major variant. Out of Omicron, various subvariants have come in, but all are behaving the same. That's statement number one. Statement number two is most of the people in this planet today have had COVID at least once, maybe twice or thrice, and majority have had vaccination. So the level of immunity against COVID presently is very different from what it was 2 years or 3 years back. So even if COVID keeps coming in different forms, different variants, hopefully we are not going to see a pandemic-like situation in the sense that it will behave like flu virus. It will behave, it will come, it will give you fever, cough, cold, few days of absenteeism from work, and you move on. It will definitely have a more significant impact in elderly and vulnerable population. So does flu. As I told you, flu virus also kills about 5 to 7 lakhs people every year. We never get to know that.
Right.
So it will be a problem like flu virus for the entire world. And hopefully in future, what may happen is that this strain of COVID gets put into the similar vaccine, and it becomes one common vaccine of flu and COVID, which you can just go ahead and keep taking on an annual basis. By the way, swine flu, remember, was a pandemic when it came.
Yes, it was.
Into early 2000s. Since then, it has not gone. We see every year swine flu case, but now swine flu is like any other flu. We don't even think about it, but it does still kill people. So COVID is going to say, now whether a major wave is going to come in India in October or not, I don't agree with that. The most prevalent strain world over is now the Eris strain, which in India, it was reported 6 months, 5 months back. But after that, the cases have not increased. I think India is placed in a very good position, the best ever in the pandemic, where our population is immune to it. Most of us have taken vaccination. So even if the strain comes in India, it will be a minor strain. There will hardly be any hospitalizations, hardly any serious people. Yes, you may feel that a new wave of flu virus has come in. And if you do the testing, it may be sort of a COVID. But we have to be intelligent to prevent the spread of the disease. So the basic thing of, if you are not well, stay at home, use mask, don't spread the infection to elderlies in your house, don't be irresponsible, come to the office and spread the infection to your colleagues. So that basic common sense measures, whether it is common flu or swine flu or COVID, would have to be followed. But I don't think we need to now really worry and debate about when it is going to end. It is going to be part and parcel of our life forever.
Right. Doctor, there are lots of questions by the audience. Do we have time for audience questions? Have we already exceeded your time? Because I would not want to.
No, if you have some important 5 minutes, I can spend more if you have some important questions which have not been discussed and addressed so far.
Yeah, and so of course, one which they say is that if one misses the influenza vaccine, like you said, it has to be taken annually, then why can one restart it or how?
Yeah. So there is nothing like missing or restarting it. If you have missed it, just take it whenever you remember it. So ideally, it should be taken on a 12-monthly basis. But if you have skipped it, just take whenever you remember it. Take the latest vaccine brand which is available. That's important. Don't take the old dated vaccine.
Also, people want to know that, recovery about COVID, that how long is, because, people are taking time to recover from COVID. And like they said, there's long COVID, which is happening.
Yeah, so long COVID is a mess. Frankly speaking, let me tell you that long COVID has a huge spectrum. And most of the times we talk about serious illnesses. of people having heart attacks and strokes and clots, that's a hugely small minuscule of people getting that. But the bigger chunk of people are coming with non-specific problems, which are really affecting their quality of life and which has become rampant. I feel that every person who has had COVID is having some form of long COVID in form of fatigue, reduced energy levels, mental fogging, mood swings, aches and pains in the body, diabetes people, their sugars getting worse, BP people, their BP getting higher, getting episodes of flushes, blackouts, all those vague feelings where the other person, family members may say there's all in your mind and there's nothing wrong with you. But actually, these are symptoms of very, very common symptoms of long COVID. And as doctors, we need to really address them. Unfortunately, we don't have very specific measures or treatments against them, but at least recognizing them, accepting them, talking to the patients, and giving them whatever support can be given is extremely important. And we also need to understand that there will be some people who become at a higher risk of having heart problems, of having strokes. So if a person has strong family history, if a person is diabetic and has had COVID, our antennae must be it's a red flag. It's more, the doctors and the family must be more at alert that this person could have a more complication because of his previous COVID. And we are generally seeing those cases. The burden of disease now because of COVID in the last 2-3 years is significantly increased. So heart problems, lung problems, brain problems, a lot of cases have started coming in directly or indirectly being contributed by their past COVID. And their COVID may be so mild that they did not even pay heed to that or did not notice it. But the long-term effects are much more serious.
That's an interesting thing, that you didn't get a bad COVID, but it's continued to be a long COVID.
Yeah.
That is a very interesting thing. Thank you so much, Dr. Buddhiraja, for being here. I'll hand it over to Aparna. Aparna, please, can you give us your closing remarks?
Thank you so much, Nandini. It's indeed been very encouraging, Doctor, that you have pointed out that vaccinations do not, in fact, reduce our immunity, but they increase our immunity. Adult vaccinations are safe with numerous benefits, enhancing individual as well as the community well-being. So happy that you have busted this myth. Your advice to all of us to get vaccinated, not only for our personal protection, but in turn for those around us, the elders, as well as the immunocompromised friends and family. I'm sure now each one of us is encouraged and can run off and get ourselves protected to create a greater society around, a greater and a safer society around us. Like it said, that prevention is better than cure. This has been a very, very educated and insightful talk, Doctor. And thank you so much for taking out your time and busting myths and putting our doubts at rest. Thank you so much.
Thank you. Thank you.
Thank you.
Thank you.
Thank you, Doctor.
Thank you, ladies. I think that was a wonderful one.
Really he spoke so beautifully. It's fantastic.
You know, and that's why then I didn't want to really go into the questions because they were never ending, and a lot of
I think he answered a lot of the questions. So a lot of that was just repetition, but fantastic. He was really very eloquent, very detailed and very precise. And we've got so many questions.
It's very important to know and, you know, address a lot of those questions, which we never do. And I think it was fantastic to, you know where one stands and what one's thing should be. I think it was fabulous.
Completely true. Fabulous. Thank you so much. Thank you, Nandini, for giving us the opportunity. And thanks, Pooja, for getting him on board.
Thank you, ma'am. It was a nice session.
I mean,
nice session.
All you girls, I think, you know, every session that we are doing is an eye opener. And I think it is just, you know, adult vaccination was something which was on my mind for a long time, because there has just been so much buzz about it. And I know that, you know, that I am petrified of injections. So I don't know how many I'm going to get done, but at least I know that these are things which are important and maybe we should look at doing them. So yeah.
Completely. Especially when everybody says, oh my God, vaccinations actually reduce your immunity. That is such a myth but he so beautifully explained
So good and
that it's not true.
yeah,
Fabulous. Thank you. And we had a good audience. I'm so glad that we had about 30-35 people log in.
We
at
had
one
about 40 at one
38.
time. So yeah,
at
it was
one time,
38, 40.
which
great.
38,
Fantastic.
which was fabulous.
Yes. Thank
So
you.
glad. Thank you.
Thank you. Bye-bye.
One nice smile. Let me take a nice pic.
It was a nice photo.
Cool. Thank you.
Thank you.
Bye.